So I want to look at the pathogenesis of hypertension. So for any disease condition, if you are looking at the pathogenesis, you are basically trying to look at what is the build up to how this disease came to be. Okay. So from pathogenesis of hypertension, let's look at this. You know, so but it's complex. You understand? A lot of things come in. You have genetic factors that are making you predisposed to having the disease, vascular issues, neural issues, hormonal issues, and the rest of it, you know. So, but the major mechanisms include, so for renal related, it has to do with there's retention of what? Sodium and water. So if sodium and water are being retained, you have like a backlog and there's expansion of the blood volume. So there's also impaired pressure natriuresis. So kidney fails to excrete sodium adequately. Then also salt sensitivity. So some individuals experience significant BP rise with high salt intake. And for the blood vessel issues, it could be from arterial stiffness, so endothelial dysfunction, structural changes where there's collagen deposition, elastin breakdown, and vascular remodeling. Then for neurohormonal factors, we have a sympathetic nervous system could be overactive, where there's increments in the heart rate, vasoconstriction and renin release. Okay. Then we have RAAS activation, where the angiotensin 2 causes the blood vessels to constrict, you know. Aldosterone promotes sodium retention and the rest of it. Okay. They also have the hormonal influence where if there's excess cortisol or aldosterone, it can drive the hypertension. You understand? Then okay. So we got all right. So genetic and epigenetic factors. We have the monogenic hypertension where there's mutation in renal sodium transporters. We have the polygenic risk where multiple genes affect the vascular tone, the renal function, and neurohormonal regulation. Then we have epigenetic changes where we have fetal programming, you know. So low birth weight leads to what? Fewer nephrons in you, and there's a likelihood of you having hypertension later. Also, inflammation and oxidative stress are there, where reactive oxygen species they damage endothelium and they reduce nitric oxide. Okay, so I think this is what we have for the pathogenesis of hypertension.